Hello and welcome, everyone. This is Caroline Garnett McGraw with The Clearing, and today I'm here to talk to you about the missing piece in addiction treatment. And here's a 4-word spoiler alert: healing underlying core issues. That is the missing piece in modern addiction treatment. So, what do we mean by underlying core issues? We mean the reasons that people use drugs in the first place, the root causes, the bigger why, the reason behind the behavior. So often, addiction is actually what psychologists call a designated issue. That's a psychological term for a problem that covers up the real problem. So Dr. Martha Beck describes it this way. She says a designated issue dominates our psyche so that other troubles can go unnoticed. That's pretty powerful. So addiction is a way that we turn our attention from our underlying core issues. And it might not start out that way, at least not consciously. People aren't thinking, hey, let me create this huge life-altering, awful problem for myself so I don't have to deal with my other problems. No, we don't think like that. Normally we're thinking, I feel awful. I feel like crap. I want to stop feeling awful for a little while. And that's how people get into addictive behavior. They want to feel better or they want to feel less bad. And they want to avoid, they want to buffer, they want to take a break from carrying around all the mental and emotional pain. And that's very human, and that's nothing to be ashamed of. However, we also recognize that the current addiction treatment paradigm often doesn't serve people very well because the current norm is to do the 12-step model or to do 12-step groups. And now, first, let me say, this really does work for a good many people. There are millions of people who have been helped by 12-step groups, and that is great. However, Harvard researcher Dr. Lance Dotis estimates that the actual AA success rate is between 5 and 10%. So that means that for the other 90 to 95% of people, there is a real need for a different treatment approach. And more specifically, there's a need for a treatment approach that addresses psychological conditions such as depression, anxiety, and trauma, also known as those underlying core issues we were just talking about. So we now know that most people who have addictions have what's called a dual diagnosis, which means that they have a substance abuse problem on the one hand, but they also have a mental health concern. And 1 in 7 people in the US have some kind of substance abuse issue. That is a lot of people, and the majority of them have a dual diagnosis. So you can really see how the addiction treatment industry has let people down by focusing only on physical level changes. You have plenty of programs that just look at behavior modification or aversion therapy. They just work on this physical level. But if they don't address the mental health issues that go hand in hand with addiction, then of course people aren't going to heal. They're not going to get better. Now, that said, more and more rehabs are integrating mental level work. They're using proven psychological techniques such as cognitive behavioral therapy, CBT, mindfulness, all of these wonderful things. This is really important because it teaches people to question their judgments and to question their limiting beliefs and to work with some of the thoughts that are generating the anxiety or the depression. So that's great. However, human beings actually function on 4 levels of self. We have the physical level, which is what we do. We have the mental level, which is what we think and what we believe. We have the emotional level, which is what we feel. And then we have the spiritual or the authentic self level, which is who we truly are. So you don't have to use the word spiritual if you don't want to, but the authentic self level is the part of you that goes beyond your mind and your emotions. So we have these 4 levels. And here, again, you can see the problem. If you have a program that's only focused on the physical level changes or just the physical and the mental level, you're missing 2 other levels of self. And from our experience, what we find is the most lacking is the emotional level support. So you have a program like AA, they do operate on the spiritual level, but the emotional level support might be missing. So there's a reason why a lot of programs lack significant emotional level support. Actually, there are 4 reasons, and I'll share them with you right now. So the first reason is a lack of well-trained and compassionate counselors. There are a lack of people who really understand how to do deep emotional work. And of the people who do understand and have been trained to do it, the demand far exceeds the supply of counselors that we have available. So this is a good problem in the sense that we need more people to be able to do this work. But it's really challenging for the 1 in 7 people, for the millions of Americans who need this kind of support, and we don't have sufficient trained providers to offer it. The second reason is that providing real, substantial emotional level work is time consuming, and it can be expensive because you're paying professionals to use their skills and to provide that support. And a lot of rehabs will just do the state mandated minimum number of counseling hours, and that varies state to state. So depending on where you live, your state might only require an inpatient rehab program to provide maybe 1 or 2 hours of individualized counseling a week. That is not enough to deal with a serious addiction issue and a serious, dual diagnosis issue. And then a third reason why the emotional level support is lacking in a lot of rehabs is that you have non-supportive and chaotic environments. You have people coming and going constantly, people entering and exiting the program. You have court-mandated rehab. You have people who don't want to be there and who are being forced to be there instead of going to jail. And that's not really an environment where you can relax or feel very vulnerable or ready to open your heart in an emotional level way. And the fourth reason why emotional level support can be lacking in addiction recovery programs is that it requires very real willingness on the part of the participant. It's not something where you can just sit back in your chair and cross your arms and be like, yeah, whatever, I'm just listening to a lecture. No, emotional level work really requires that you participate and you be active and you engage with your own recovery. So that's kind of the lacking side. On the bright side, here are some things to look for if you personally are looking for an addiction recovery program. First, look for a program that works on all 4 levels of self: physical, mental, emotional, and spiritual. Ask what particular counseling strategies the program uses and research the efficacy of those strategies. A lot of times you'll see websites that are very shiny and they look great, but they don't actually tell you what treatment modality is used. So make sure you get that clarified right up front. Also look for a program that provides a safe space, free of judgment and shame, and that encourages people to share with honesty and with vulnerability. And when I say safe space, I don't mean it has to be a luxury hotel, but I do mean it needs to be a place where your privacy is protected, where you feel physically secure, and where your basic needs are met and honored. You also want to look for a program that teaches you self-counseling strategies so that when you leave after 28 days or 30 days or more, then you are able to go home and take those strategies out into the real world and use them. You want to be able to be your own best counselor and your own best advocate once you've gone through the program. So, of course, in our program, we offer all of these things, and we invite you to check us out at theclearingnw.com. But that said, we know that we're not a perfect fit for everybody. We can only welcome 11 participants at a time for our 28-day session. So we know that, again, the demand for rehab far exceeds what we can supply in our program. So we have put together a bunch of roundup posts of some of the best non-12-step rehabs in our region and also in the country. So I will put links to those in the comments of this video so you can check them out. And of course, you're more than welcome to reach out to us. Visit theclearingnw.com. And if you'd like to talk to us, we're always available for confidential calls. But really just want to encourage you to look for a rehab that addresses and heals underlying core issues and works with you on all 4 levels of self. Thank you so much for your time. Have a great day.